Well, good morning, Carol Johnson.
Good morning, Bob Ponce. How are you?
I'm good. How about you?
I'm doing well. Yeah,
Mm-hmm.
very
Mm-hmm.
well, in spite of all that's going on.
Mm-hmm. So, I wanted to start today talking about what may turn out to be the biggest super spreader event since the pandemic started, because it gives us an illustration about uh, just how bad, stupid, how stupid behavior can really make a difference. I'm hearing some feedback. Are you hearing that too?
Yes, I am.
Okay. Let's see if there's something we can do about that. Um, hmm. Maybe if you could turn your sound down a little bit. I don't know if that's going to help. Yeah, I think that helps. Okay, good. So um, they had this biker rally in Sturgis, South Dakota, back on August 7th. And I want to take a look at some pictures here. Um, and I think the thing that we'll notice is there's no social distancing here. So this rally brought, I've heard, between 250 and 500,000 people to this rally over the weekend of August 7th. And what were the results of it? Let's take a look at the results. So this is a map put together by researchers at Georgia Tech. And as you can see, in the middle of that, it's nothing but red. And the red represents the chances that there will be at least one COVID positive person at an event that you go to. And if you can see up here in North Dakota and South Dakota, most of these counties, the chances are 99% that wherever you go, somebody's going to have COVID. And in the middle of this, right in dead center in Meade County, South Dakota, that's where this event was. And so from August to now, basically COVID exploded in this region. And this whole region is hot red. If you remember going back, a couple of months, the hot spots were Texas and
Hmm.
Florida.
Yeah.
And obviously we went back to the spring, the hot spot was New York, which as you can see is, by comparison, New York is much better. But this super spreader event happened because so many people in one place just ignored all the warning signs and came and spread it to the entire region. And that's why we're now in a situation where COVID is just ravaging the country from the middle. And so we wanted to start out with this because this is an example of what happens when people ignore the science. And we are now going into Thanksgiving. And as we've been saying for several weeks, this is a time where we all have to make some very, very difficult decisions about how we want to spend our Thanksgiving. Now, I saw on Twitter this morning another one of these idiot doctors who recommended that we have a people have a large Thanksgiving gatherings because some of the people won't be there afterwards. It'll be their last Thanksgiving. And so that's the reason why they have a large Thanksgiving gathering.
I've never heard such irresponsibility
Mm-hmm.
in my life, and this is coming from heads of state. Well, let's start at the former administration. You know, Superspreader Charlie. You know, and all his merry men. I
Mm-hmm.
mean, some of the things that people are saying, and sadly enough, there are a lot of people that are going to listen to that
Mm-hmm.
because they want to have these gatherings, and we certainly get it. I don't think there's anyone on our team, anyone that I know that does not want to go to a family or a friend, gathering just to greet people. But this is really a matter of life or death. For this man to make this just stupid comment that
Mm-hmm.
this may be their last Thanksgiving, well, you want to assure that this may be their last Thanksgiving. And
Mm-hmm.
not only that, but how many people may they be taking with them?
Mm-hmm.
And that doesn't
Exactly.
have anything to do with just somebody's age. They
Mm-hmm.
need to stop that in the beginning. Maybe they didn't know, that young people would get it. I mean, it made sense that
Mm-hmm.
older people with comorbidities, with people with any type of illness that will age it,
Mm-hmm.
would more than likely be most susceptible to this.
Mm-hmm.
But even if someone had an illness, they didn't have to be aged. They could be susceptible to it. But
Mm-hmm.
to not just kind of just put it out there that everyone, everyone has the possibility of getting this. We saw the children numbers mount. We
Mm-hmm.
saw the teenager numbers mount. A lot of people in their 30s, healthy people with no underlying illnesses, began to die. And it seemed like even then they weren't really paying attention. They
Mm-hmm.
still kept pushing the older population. But that is just one of the stupidest comments I've ever heard.
Mm-hmm. So, we bring this up to set the stage for the conversation that we need to have, because as we are at a point where we're getting showing 150,000 new cases per day. A few weeks ago we were astonished that it was 60,000 a day, and then it went to 90,000 a day, and this number just keeps going up. And it's going up because and it's not just super spreader events, it's mini spreader events. Because people think, well, I'll just have a small group of friends and we're going to be okay. But all it takes is one person in that small group of friends, and now everyone's got it. And these are some of the actions that are driving this thing further and further. And this is why we have to have this conversation about Thanksgiving, because Thanksgiving, you have all of, it's a perfect storm. You have a lot of people traveling across great distances, and with the traveling, you're going to be exposed to people who are more than likely carrying it. And then you take it into what you consider to be a small social setting, but it's indoors, it's closed, and it's more than likely that if one person brings it in, everyone is going to leave with it. And it's just the facts. So I think people need to really get creative and think long and hard about, if you're doing Thanksgiving or how you're doing Thanksgiving. There are alternatives. You don't have to do Thanksgiving on Thanksgiving Day, which is the day that everybody is traveling and is more than likely things are moving around. Um, you can do a Zoom and connect with people virtually. And I know people are like, that's not what I want to do. We're not going to have the food and all that, and I understand that, but this is a point where people have to make hard decisions and make sure you make the right decision, because there are a lot of people who are not with us now because they made the wrong decision. And if you make the wrong decision, the results come fairly quickly. I'm still thinking about Herman Cain at the Republican convention, hugging up on everybody, and he was gone in less than a month. Ben Carson now has it. So many of the people in the White House have had it because they've ignored it, and so many of their followers have it. Looking at that map of the Midwest, North, South Dakota, all those areas, it's the areas that are red for COVID are also the same areas that were red for the election. And and it's not to get into politics, but to understand that ignoring the science has consequences.
The sad part about it is that when again we're talking about Thanksgiving, so the thought of the decision being made easier, considering if you love the people that you want to gather around, the thought of one person in there having it, the thought that for them to say 10 people, see, people will go by a guideline like that. Okay, we can't have more than 10 people, but now let's consider 10 people in what size apartment? Is it a matchbook apartment where everybody still has to sit in close proximity? Everyone's not living in an apartment where you can actually distance in a living room, or certainly not a dining room. So, people will listen to that and say, oh, well, they said we can have 10 people. But if you're 10 people sitting shoulder to shoulder, when you eat, you can't eat with a mask on. We have a habit. We're eating, but we're talking and everything else. And if food is flying, imagine what else is spewing around the room. Just the fact that these are your loved ones, that should make the situation, the decision easier. I want to live. I want you to live. I want to see you again in 2021. But the bottom line is, if we don't get this under control, people are talking about we want to go back to normal. You cannot go back to normal unless we do what needs to be done today. Because right now we have no normal. This is not normal. And what we see, that people are angry. Some people are so angry that they refuse to follow the protocols and wear masks. They don't want to socially distance. I have neighbors that still don't get it, that want to get on the elevator with me, and my elevator is not 6 feet long. They want to get on the elevator with me without a mask, and they don't get it.
Crazy.
So we're in dire straits, and I know, like we said, we're COVID weary and everything, but the sooner we pay attention and the sooner we listen to the medical professionals who are telling us to wear masks over our noses and our mouths, to socially distance, to wash our hands vigorously upon coming into our homes before you start moving around the house, especially if you have other people living in the home with you. Paying attention to each other, monitoring each other, especially your children, because they may be suffering from it. And so many schools are being closed down because kids are showing up positive. Staff are showing up positive. So pay attention. Is that child different? Are they lethargic? Are they tired? Are they listless? Do they sound, a little off? You know your child. Pay attention, because we're all moving in and out now. And people could very well be bringing it in. So if you stick to these protocols, we have a better chance of bringing this down and returning to some semblance of the lives we had. But I don't think it'll ever be back to the way it was.
Now, you mentioned closing down of schools. Let's talk about that, because we know from where these rates are that we may be close to seeing a shutdown in schools again.
Yeah. I'm like, I don't understand it. It's like a no brainer. Just shut the schools down. Early on, it was said that the schools would be closed until January 2021. Shut them down. You know,
Mm-hmm.
because a lot of these schools have several satellite schools in it. So if you've got four schools in one building and people are testing positive in each one of the divisions, and this keeps happening, you open, you close, you open, you close, you open, you close, the numbers are rising. You're finding more and more people are showing up, and the testing is random. It's not like everybody's being tested every day.
Mm-hmm.
We already know that taking a temperature is not, like Bob, you always say, the feel good moment.
Mm-hmm.
We know that that's not saying anything. If you don't have any symptoms, you will not have a temperature,
Mm-hmm.
you know. So, or you may not have a temperature. Let's put it like that. Um, so that's definitely not a surefire method of determining whether someone is carrying this illness. But if people keep popping up, the staff and children alike, you're testing them randomly before they come into the school. That's just not a good approach.
Mm-hmm.
Shut them down. You know, playing Russian roulette with kids' lives and the staffers. People are showing up because they have to show up. People have to work. And if the
Mm-hmm.
school is open, they're going to take a chance because they want to take care of their families. Some people have no other choice. But get that unemployment insurance out there so that people can actually stay home, keep themselves protected.
Yeah, we're at a very, very dangerous point because we know that a lot of what we're dealing with came from the fact that there was no coordinated federal response for this. And unfortunately, it looks like we're still not going to get one until the inauguration, January 21st. So that's a long time from now. It's a lot that can happen between now and then. And most of that is not good. Um, Now, I also want to take a look at our local map, and just so we can have a sense of what's going on in our community. Where are our hot spots? All right. So this is our map of positivity rates in the five boroughs. As you can see, the darker it gets, the closer it gets to, 6 to 7%. The lighter it gets to zero. And as we can see, as we start to look at what's going on in our area, there's a lot of dark spots, particularly East Harlem. We're looking at 2.79%, and 2.82%. Up in Hamilton Heights, 10031, it's already 3.26%. Washington Heights, 2.87%. So going up and down that strip, you see a lot of red spots. And then we see what's going on in the Bronx, Concourse and High Bridge, 4.56%. Morris Heights, 5%. So we're seeing the same things that we continue to see from the beginning of this. What we can also see, though, is Staten Island is is dark red. Staten Island is out of control. And again, we have to look at Staten Island as a place that was very, very pro-Trump, very, very anti-wearing masks and anti-this and anti-that. And you see the results of that behavior. You've got Staten Island is separated from all the other boroughs. And so whatever is going on there is directly related to their own behavior. So we're seeing those hot spots. We're seeing obviously spots in Queens. And let's talk about the fact that we feel like the numbers are being underreported in our areas because of the gap in testing, and no one is talking about that. But these these numbers assume that the testing is even everywhere, and we know for a fact that the testing is they're over tested down where they're not having a problem, which is Midtown and Lower Manhattan, and we've been under tested in our areas in Manhattan, in Upper Manhattan, Harlem, and the Bronx. So, whatever we're reporting, assume that these numbers are underreporting. And as we talked about last week, we already know that Harlem, the rates have been surging in 6 out of 8 of the zip codes in Harlem, and that's with sporadic testing.
And so now, once again, uh, some attention is going to NYCHA. You know, it's pretty easy to assume that, yeah, you're going to have large spreads in NYCHA. You know, the smallness of the elevators, the inability to really socially distance. The apartments are not that big. There's usually larger apartments in NYCHA housing. Um, these are also a lot of people who, you know, are those frontline workers, but are underpaid frontline workers. You know, the deli workers, the delivery people, you know, they're living here and they're around a lot of different segments of people, you know. So now they're supposed to be targeting certain NYCHA houses where they're going to put up testing sites again. I remember when that happened, towards the middle of the pandemic. Our complaint was that the city was moving into the second phase. We were still in the first phase in areas like East Harlem. They were ready to move to the third stage. We were still in the first stage. As you said, the lack of PPE distribution, locations designated, no one shows up. Locations designated, and they show up 2.5 hours late with the distribution, you know. And then you saw places like Central Park and down in the 70s. Those locations never changed. So if you just woke up and said, oh, let me go get some masks, you knew exactly where to go to find it. Our locations just kept moving around, moving around, moving around. Or, like I said, we had designated spots from the city. No one showed up. They were on the wrong side. They told us nobody told them where they were supposed to meet us. So by the time they got to us, they only had 1/4 of the mass left. You know, we were getting things like that. We had one testing site, 100,000 people, down almost at the border of Harlem. East Harlem goes from 96th Street, FDR Drive, 96th Street, east of 5th Avenue, all the way up to 143rd Street, the east of 5th Avenue. It is a humongous area. And yet, we had one testing site. And now we have 3. So there's another thing with these pop-up sites. They're supposed to pop up, I thought it was kind of weird, in ice cream trucks. That's designated to be around the city. When I went to the map, which we are constantly told to go to, nyc.gov, Manhattan wasn't even listed on the pop-up sites. And so what we do have consistently are the urgent cares, places where you have to pay.
Okay. Mm-hmm.
You know, knowing that a lot of people cannot afford to pay. But those places were consistent and they were here, the first testing sites here. And they're still there. Now they're here in masses, you know, quite a few that we can get to, 10, 12 of them that we can get to. But how many people can afford it? How many people actually have the insurance? And how many people are afraid to take the test when they say, well, you know, you can bill Medicaid or you can bill someone. What's to say that Medicaid is going to pay it. When people are food insecure, people are afraid to, they're deciding whether to pay their rent or to buy food. It's absolutely insane, and the treatment continues.
Mm-hmm.
That's why we do this,
Mm-hmm.
you know.
And so, those of you who are in touch with our elected officials, you got to talk to them about this because, we are still getting the short end of the stick in terms of the resources that are allocated to fight this. There's a lot of talk, but when it comes down to what's actually happening on the ground, we are not getting the testing resources that we need in order to know where we are and to combat it. You can't fight what you don't know about. And if you don't get tested and you find out later on at some point in time, now you're at a situation where you're dealing with something that's more advanced. And what we know about COVID-19 is it can rapidly get in your body, and whether it puts you in, you know, emergency, or whether it's long-term effects, even people who have recovered from the worst of the symptoms are living with long-term effects that include your breathing, that includes heart, that can include brain, gastrointestinal. There's so many different long-term effects that this disease is having, that researchers are only now starting to get a handle on it. And so we again urge you to take this time to really focus on learning about your immune system. If you're going to have a Thanksgiving dinner, learn about the food sources that have the nutrients that can actually help you fight against this. And we talked about this, vitamin D. You might want to go for fish instead of turkey, because most fish have vitamin D in it. Eggs have vitamin D. Milk has vitamin D. Meat does have vitamin D in it. So you want to learn what these food sources are that can help build up your body with the nutrients that are going to help you fight it. Vitamin C. There are lots of different fruits and vegetables that have vitamin C. Now's the time to try out that Brussels sprouts recipe. Try out the broccoli, the cauliflower, citrus fruits. All these things, you want these nutrients flowing through your system. You want zinc in your system. You want vitamin E in your system. You want selenium and magnesium. Do your homework and make your moves purposely between now and the end of the year, because what you do is really going to determine, it's going to determine whether you make it to 2021, and it's going to determine how you start out 2021. This is a time where you really need to be concerned with your health and well-being, and the health and well-being of your family and community. Plain and simple.
Yeah, and again, as you know, we operate on the yo-yo system. You're on your own, because there's not enough information out there. Let's be real. We're still dealing with a virus that people don't fully understand. It just keeps morphing in so many different ways, you know, and misinformation, people finding out that they had the antibodies, but they don't understand what that means. That if you had the antibodies, because the antibodies build after getting COVID infected. How long does the antibodies survive? No one knows. First, it was like 8 months, 6 months, 4 months. No one really knows how long those antibodies live. In some cases, they said they've seen where the antibodies have died after 3 weeks. So people really want to believe that they hear that they think they're immune. Do not listen to what you're hearing from these so-called administration people who are trying to tell people they're immune. They had it and I'm immune. That cacophony of drugs that he was given, we had those things aren't even approved. And don't listen to that. And the one reason why you shouldn't is because if you get it, you will never get the $100,000 plus treatments that they were given.
Yeah, if there's anything that this whole virus has shown, it's the gap between resources. From day one, people in affluent neighborhoods were able to get tests quickly, rapidly, and they still can. And they're still the most tested areas. We've seen the maps between the areas that are most tested and least tested, and you can see it's a total reverse of the areas that are hardest hit. The areas that had the least amount of COVID have had the most amount of testing. The areas with the most amount of COVID have had the least amount, and it's been sporadic. And the lack of information, even when testing sites are available and the city doesn't publicize where they are, what good is a test site if no one knows where it is? It's useless.
Right. And it's interesting when we looked at the map downtown, the Lincoln Square area,
Mm-hmm.
and there was one dark spot.
Yes.
There's a housing project down there.
Ah, yes, you're
Amsterdam
right.
Houses. I think that's the name of it. 68th Street.
You're right. You're
Yeah.
right. Mm-hmm.
And so I don't think that's ironic that one area was like sort of crimson,
Mm-hmm.
red.
Yep.
So it goes
Absolutely
back
right.
to the situation with the housing developments and the places that have the most, like the largest accumulation of housing projects in East Harlem. Yet when the initiative came to the housing projects, East Harlem's was one of the last people. East Harlem was one of the last areas to get the testing in NYCHA.
Mm-hmm. Mm-hmm.
And again, that location was almost down on our border, like down near 102nd Street. Remember, we go up to 143rd Street. We've got a large um, group of seniors, people with handicaps. People are still fearful, more so now, almost like in the beginning of taking public transportation. There's not been any more information on how those buses are being sanitized. People are still getting on and taking their mask off and wanting to fight about it, protect my rights. But it's about my protecting you and you protecting me. So the situation still is the same, even though you say that it's going to get worse in the winter. The resources are worse in those same areas, the hardest hit areas.
So I think that's all we really have to say is protect yourself, make smart decisions for this holiday. Start planning out what you're going to do now. Have the conversations with your family members and friends. Really consider what are your options. Staying home is the best option. If you're going to, if you feel like you must travel, I recommend that you either try to travel on not on the heavy days. Try to avoid public transportation. Try to keep the size of your gatherings down to a minimum. This is not the year for the big 20 people at Thanksgiving. It's not a good move. Um,
And the other thing is, uh, the medical profession who said that if you really want to travel, you want to fly somewhere and you haven't been tested, it's really too late for that. It is really too late. Because if you test positive, you have to go through a 2-week quarantine. So it's really a little late. So the stick close to home, keep the group small, zoom in. You can still make your favorite dish that you would have brought to the to your Thanksgiving dinner. Just make a smaller dish. You know, you can still do that. As Bob said, it does not have to be on Thursday. But please, please, the large gatherings, 10
Yeah,
people in a small apartment, no, no,
don't do it.
not advisable at all.
So that's our report for this week. We just encourage everybody to be smart and stay safe. We can't reemphasize it enough because all of the examples are showing what not being smart is. We started out talking about the motorcycle rally. I want to show you this. This is San Diego State University has done a 63-page report on the effects of the Superspreader rally in South Dakota. This is it. I mean, these are historic events right now, and historic stupidity is what we're watching. Um, there's no reason why the U.S. map should look like it does now, other than the fact that people have ignored the warning signs and ignored the science. And as much as we are critical of what's going on here in New York, the one thing that I would say that New York did right at the beginning was to shut down the super spreader events, because if you imagine if we had had a St. Patrick's Day parade, New York map would look like South Dakota's does now. It would probably be worse. So it would have made our whole region, virtually uninhabitable. So actions have consequences on both the large scale and the small scale. Make sure that your actions have the right consequences for you, your family, and your friends this holiday season.
Absolutely. And that's our desire for you to just stay safe. Separate the nonsense from things that make sense. Pay attention to um, read articles on what happens when groups gather. They had some super spreader events in New York. It was up to like big warehouses. Um, no liquor license, but there was liquor flowing. Places were packed. Um, no mask, of course, no social distancing. But sometimes I think we want to get rid of this thing so quickly that logical thinking stops coming into play. Those people are getting on the same buses and trains that we're getting on. People are not stuck in Staten Island. They get on the ferry. They're coming into New York. They're coming to a job near you. They're coming somewhere close. They're coming here.
Mm-hmm.
Newark is on fire. They're an hour away. There's no restrictions on people coming from Newark to New York or Connecticut to New York. These places are on fire. A lot of people in Newark work in New York. So don't get caught up in these boundaries, because this is happening in South Dakota and North Dakota and in those mid states. What do you think? They can't travel to New York? These people came from all over the world. And I'm sure we had a whole lot of them, New Yorkers. We had bike clubs here. New Yorkers were out there. So let's not get caught up in the boundary in terms of, well, that's over there, that's over the bridge. You got to take the ferry. We're not talking about buses, trains, and boats. We're talking about people that move from one location to another, and they're bringing this gift that keeps on giving. And it's not a gift that you want to get, and it's not something that you want to bring to your home. And remembering again that people that are asymptomatic, if you're running around in these different groups and you're coming back home, and you just may not have any symptoms and infected your whole entire household. And this is what happened with Keisha Lance Bottoms, when she was shocked.
Mm-hmm.
She said, I got it. I socially distanced. I wore the mask. I did that. I got it. Then Later on, it was found out her whole family got it. Everyone in her household. Now her husband is experiencing symptoms. So there's a lot of people that's getting it and they're saying, I did everything right. So if you're doing everything right and you get it, what is the chance of you doing everything not right and getting it? And in that same instance, bringing it home. So keep the focus. I protect you, you protect me.
That's it. So stay safe, y'all. We'll be back next week.